Welcome to Health IQ, a podcast from the Quay County Health Council. In this podcast, we are exploring a variety of health topics that affect our community and probably yours too. We are not professional podcasters, but volunteers that have a passion for wellness. We will share practical ideas and resources for people with limited access to services, and we have some fun tips to help you and your family stay healthy and well. Increase your health IQ as you listen to our members as they talk and share with experts and others about the health matters that matter to you.
Vaccine, Magic, and Alchemy, Episode 9, Unraveling the Science That Will Make You Safe.
Welcome back to Health IQ. I am Brenda Bishop, your host. Today, we will be discussing an important topic to help our families stay healthy. Joining me at the table is Rickie Eslick, our Quay County Public Health Nurse Manager. Our crew today is Robert Hockaday, Joyce Runyon, and Gordon Runyon. Thank you, Rickie, for joining us and to bring us some accurate information about a tough topic. A couple of months ago, we did a really interesting podcast about the history of vaccines and when they were developed and things like that to help actually prevent death in like the 1800s. So a lot has changed since then, but I was wondering if you can help us understand how those vaccines work in our bodies.
Okay. So what happens is when you get a vaccine, what it does is it reduces the risk of getting a disease by working with your body's natural defenses to build protection. So when you get a vaccine, your immune response responds to that. Vaccines are going to train your immune response to make antibodies, just as it would if you were actually exposed to the disease. And because vaccines only contain certain weakened or killed forms of the germs, like viruses or bacteria, they don't actually cause the disease or put you at risk of the complications of that disease. And I just want to preface that the information that I'm giving you, I got it from the World Health Organization, the CDC, and then also the Human and Health Services.
Thank you for citing those, because often it's important to know where we're getting accurate information and where people can look up accurate information. And the fact that they don't give you the illness is an important point as well. So we had heard a lot in the news about different kinds of vaccines, messenger and active. Can you tell us a little bit about the differences between those?
Okay. So there are different types of vaccines. There's inactivated or killed vaccines. They're made by inactivating or killing the germ in the process of making that vaccine. And so what that does is that's going to produce an immune response. They are different than live vaccines because you might need more than one. So some of the examples of an inactivated vaccine would be the inactivated poliovirus, the flu, or rabies. There are some that are called subunit vaccines, which only contain a fragment of the germ, and they do make a strong immune response also. And then some examples of those would be HPV or shingles. And then there are live vaccines, which are they're the closest to natural infections. And then some of those live vaccines are going to be your measles, mumps, and rubella. And then the messenger one is what you're talking about is it's a COVID vaccine, and that uses the pathogen's genetic code, and that teaches your body to make a specific protein that's unique to that virus, but it doesn't make the person sick with that.
Okay. So that is a lot of difference between the different kinds of vaccines. And lots of research has gone in, I'm sure, to all that development around that. Another word that we've heard thrown out a lot the last few years is herd immunity. Something I had never, ever really heard about until that. Can you tell us a little bit about herd immunity? And maybe I know that like smallpox has been eliminated worldwide. So was that herd immunity?
The herd immunity or community or population immunity, it's an indirect protection from infectious disease that happens when a population is immune, either by being exposed to the disease or getting the vaccination. It's important that we do the herd immunity mostly through vaccination. It helps protect those people that can't get vaccinated. And herd immunity is possible with vaccinations that are working against one organism germs, such as measles or smallpox. It doesn't really work against like flu or tetanus. The reason it doesn't work for tetanus is because that's a bacteria that lives in the soil. If you're not vaccinated, you can still get it. Mm-hmm. And then for the flu, it doesn't work because the flu has, it can mutate. And so what it does is each year they try to produce a flu vaccine that's going to work against whatever strain they think it might be. There are 4 strains that are usually the most common and the most dangerous. So that's why.
And that's like those years that we've heard like avian flu or I can't think of any of the other ones, but those were years that it mutated into those things.
Mm-hmm. Yeah.
Oops.
So yeah, and usually you'll hear like flu A or flu B. Mm-hmm. So that's why the herd immunity doesn't necessarily work for that.
Well, that's interesting. So I was thinking about all that as you were talking. I know that there's a lot of hesitation around getting vaccinated. Mm-hmm. So what do you tell patients about why or how safe it is?
Okay. So whenever people come into our office, the Quay County Public Health Office, we discuss things that could happen if you get the vaccine. We talk about the vaccine and why it's important. The United States has the safest vaccine supply in history. There is a lot of testing in place. There's a safety system. They evaluate vaccines. They monitor it. Serious and complications are very, very rare. Generally, what happens is when you get a vaccine, you end up getting sore at the spot, tired. You can have a little bit of fever and fatigue the next day or 2, but that's the most that I've ever seen.
And there are some things you can do to even relieve that pain at the site prior to getting that vaccine.
We don't really recommend doing it prior to, but you can take Tylenol according to the label instructions after the vaccination. But they don't really recommend doing it prior to because somehow it doesn't give you the full response to the vaccine that you need.
That is a new piece of information I did not know. Because I can remember when my children were little, we made sure that on the way to the doctor to get their vaccines, we gave them their little dose of Tylenol.
Yeah. No, they don't recommend doing that beforehand. It's after the vaccine generally if you need it.
Okay, cool. There's always changes, just like in other forms of science. There are always new updates and changes too. So one thing that I have been doing a little research was to do some radio ads about vaccines, and then I'm finding super confusing. So when my kids were little, we had these nice little cards you folded up. Now I know people lost them, and that's okay that they have a better system now.
Yeah.
But it said, when you were like 2 months, you went to the doctor, and 4 months or whatever the schedule was. Well, now it's just like really hard to figure out by looking at those charts that are out there. When do we need to take our children back to get their vaccines? Do you have a simple method to tell parents?
So we still have those cards if people want them, but they are hard to keep track of. I definitely lost mine. And what we do have is the New Mexico Immunization Information System, and it does have a registry on there that parents or caregivers can get on. And what you do is you'll put your information in there, and it will tell you what vaccines are recommended to take next. It's called vaccinum.org. So you can get on that website and look it up. If they need to, they can always call our office. We can help them with that information. The cdc.gov has a printable vaccine schedule on there, and they can look at that also. If the kids are in school, the school nurses should be looking at those records and letting parents know. Same thing with Head Start. They do that as well.
Okay. Well, when I look at those charts online, there's all these spaces.
Yeah, it can be confusing.
It's not like cut and dry that says 2 and 4.
Yeah, it's not. And some of the vaccines, if they've missed them, there's a time frame for those. So they can always call our office. But children do need to come back for vaccines. I know there's been parents that are like, oh, I just got one and I'm done. No, you need to continue to get those on to being an adult.
So you mentioned getting behind. And can you tell us what shots, or I don't know how I want to phrase this, but which are the most important to make sure we're not behind on, or for our children?
Well, just staying on schedule, it's really important for children and adolescents. But if they do get behind, because that does happen a lot, they can come into our office. And like I said, there are some that are within a certain time frame that maybe they don't need that one. But we can always look it up and get them right back on the schedule. We have children that come from different countries and maybe they don't have their vaccine record. So what we do is we go ahead and continue them on with what it's recommended for them to have for that age group. I know the meningitis, they put a second dose in there for 16-year-olds. So a lot of 16-year-olds don't have that second dose. So that is one thing that I've noticed in our county that's behind.
And that was pretty new last year or the year before that they did that?
Yeah, that was a new one. So that's why some of those kids are behind. But again, if they are behind, just make an appointment at our office or at their doctor's office and just get that catch-up schedule back on.
So you were talking about the record, and I was curious, do all healthcare providers put the information in the record, or is it just those that are received from your office?
So when you go to your doctor's office and your child gets vaccines, the doctor's office keeps track of that. They should be putting that into the New Mexico record. What I would do is I would just ask the nurse or the doctor, how do they maintain those records? If you can get an official copy, and if they do put it into that New Mexico website. If you go out of state, which happens a lot here, you can just get that official record and you can bring it to us and we could put it into the New Mexico website for you.
That would be really handy.
Yeah. And if you don't have that record, we can have you sign out consent forms. So that way we can get those for you and still put that in the New Mexico record for you, because they don't cross. Like if people go to Texas, it stays on Texas. It doesn't come into New Mexico. So a lot of parents don't understand that either. So.
Right. So another unique thing probably to New Mexico is how we pay for child vaccines.
So New Mexico is a universal state, and that kind of means that through a combination of our state and federal funding, all children up to the age of their last date of being 18 years old can get vaccinations free, regardless if they have insurance or any income status of their parents. They can come to the Quay County Public Health Office. We offer almost all the childhood vaccines, and it's a federally funded program, and it's free. It's vaccines for children. So their doctor's offices, they may charge administration fee, but our office doesn't.
That's wonderful. And such a great service to make sure that our kids stay up to date and can fulfill the requirements that are required by the school systems too. So let's switch a little bit out of childhood vaccines and into adult vaccines. Do you also provide those there at the public health office?
I do provide a very limited amount. Generally what I provide for is those that don't have any insurance, or if their insurance doesn't cover vaccines. So for adults in our office, what I do have for those that don't have any insurance, we have, let me see what I have. hepatitis A and B, the pneumonia vaccine, HPV, Tdap, shingles, and the flu. We recommend that if people do have insurance, that they go through their primary care providers. I know that I've gotten a lot of questions about RSV vaccine. There are providers within our town that do provide that also. And then the shingles also, a lot of providers in town provide that as well. So if they don't have insurance, we definitely have some for them. They'll just have to call and find out what we do have.
Right.
Mm-hmm.
And then also there's the COVID and the flu that you offer. Is that only for people who don't have insurance, or how does that?
So with Quay County, because our office is the only office that's offering COVID to the community, we are able to provide that to those that have insurance or no insurance. They'll need to call our office because I can only order it and I only get a limited amount of COVID vaccine. And they can just make an appointment and we can call them when we get it and schedule it for them. The flu, anybody can come for the flu shot. But the COVID, just because we're the only ones in town that have it, we can provide it to anybody.
Well, that's good to know because there are some people who still need to get that new booster because it has been so hard to get with, transportation issues and having to go so far away.
Yeah, I know if they do work at the hospital, though, they need to go ahead and call the clinic at the hospital because I think the hospital is providing it for their employees.
Okay.
But I think that's all they give it to.
All right. So I find a lot of this very interesting because it's just those little details that we don't know about and how to get vaccinated. Mm-hmm. And like I said, many times we don't go to our healthcare provider very often anyway. Mm-hmm. And then there's just so many things going on. You forget to ask about, are my vaccines up to date?
Mm-hmm. Yeah, that
so
does
we
happen
do
a
want to
lot.
encourage people that whoever they are going to check to see if they're up to date, especially with the Tdap and some of those others that would affect us as we get older. Mm-hmm. And shingles.
Yeah, I know the pharmacy does have that. You just need to call them and ask about it. Mm-hmm. So.
And I heard that our pharmacy also has the RSV, but I don't know if you have to get a prescription first.
You have to call for it ahead of time, but I don't think you'll need a prescription. You just have to meet the criteria, which is, I think you need to be 60 or older, I believe is what it is for that.
Okay, cool. So we'd like to end our podcast with some food for thought.
Okay.
And today's, I found this quote, or the crew found the quote, I actually think, and it's, medicine comes with hope. The hope of having a healthy child, the hope of being able to raise your family.
Uh-huh.
So what do you think about that? To me, it's like, when I think back to that history,
right,
and how kids didn't live very long because of diseases,
right,
and now we have hope with our vaccines.
Yeah, that is a good point. I think we all want our children to grow up healthy, and if vaccines is a part of doing that, I think we should do that. We don't see chickenpox hardly at all anymore, and that's a vaccine. I didn't get that when I was a child. My child didn't get it. She got chickenpox and it was horrible. So,
oh man, I had chickenpox in high school that I was out for weeks. Mm-hmm. It was awful.
Yeah. So we don't see that very often, and we give a vaccine for that now. So I think that's, I just want our children to be healthy.
Yes. So I just thought it was a really neat quote about that hope and giving us hope. And I think so often we forget that little piece of hope there that we have to be able to raise a healthy child.
Yep.
Thank you for joining us. And we have a special gift for you.
Thank you.
To help you remember our podcast and your time here. Okay. And maybe you'll come back with a different topic sometime. We'd love to have you come talk about something else.
Maybe I won't be as nervous.
Okay. So Thank you for joining us today as we learned about how vaccines work to keep us healthy and give us hope. Please come back next time as we discuss ways to save money on our water bills just in time for summer.
Special thanks to our guest contributor, Rickie Eslick of the New Mexico Department of Health. Our host today was Brenda Bishop. Podcast crew included director Robert F. Hockaday, producers were Robert F. Hockaday and Joyce Runyon. Video crew was Gordon Runyon. Music provided by David Morris.
This podcast was made possible by a New Mexico Department of Health Better Together grant. Additional information about today's topic will be on the Health IQ blog located on the Quay County Health Council's website at www.qchealthcouncil.org. Be sure to follow the Quay County Health Council on YouTube, Facebook, and Instagram at Quay County Health. Thank you for joining us today. If you have ideas for future podcast topics, be sure to reach out to us at healthiqpodcast@gmail.com. This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.